few years ago, I was the Deputy Chief Executive of St Mary's Hospital in Paddington. Some of you may know St Mary's on Praed Street in Paddington. And one of the things that I did in my 4.5 years there was to essentially lead the organisation's clinical services and some of its support services into a merger with Hammersmith Hospitals and Imperial College to form the organisation Imperial College Healthcare NHS Trust, which was launched in October 2007. And picking up Andrew's important point about timeliness, the uncertainty for all of us in this room about the future is significant. But my experience of my time at St Mary's was that the uncertainty for our consultant staff, for our nursing staff, for our administrative and clerical staff, for our physios, our pharmacists, and our managerial staff, is significant as well. And so as Chief Executive, I'm very mindful of my experience of leading another organisation through this process, that we have to move in a timely fashion in order that the distraction about personal futures, about organisational future, is as short a possible time as we can, in order that our clinical staff can focus on the important business of looking after patients. That's the business we're in. That's why everybody turns up to work on a cold January morning, or perhaps flags down a police car to bring them in to operate on a patient urgently. You'll have seen the stories of staff walking through the snow in order to get to work. They do that because they're in the business of looking after patients. Going through a merger can be a distraction, and the shorter time that we take as possible to reach a decision and then secure the implementation, the better. But we have to do it in the right way. So going on to a couple of questions I'm sure are likely to come up during the Q&A session, so we thought we'd at least address them in some detail initially. So what about, how does the transaction affect the plans to redevelop our hospital site? So first and foremost, you will know that the plans to redevelop St Helier site are well advanced. Whilst the bulldozers and builders are not yet on site, that project continues along its timeline, and we do not expect that the transaction will influence that. The building isn't due to open until 2017, and there's a significant amount of enabling works, demolition and building that needs to be completed before we progress to move services into the new build. So our expectation is the transaction doesn't impact on that programme. The money's set aside within the comprehensive spending review, and that will continue. In terms of the redevelopment of the Epsom site, you'll know that was much earlier in its development stage, and the thinking currently is that until the future of the hospital in the context of the foundation trust status is secured, any suggestions about resources being made available by Strategic Health Authority or Department of Health, they wish to essentially wait until October, until we've determined which organisation would partner with Epsom Hospital, in order that then discussions about securing resources, whether it's, as Andrew said, through raising capital through the private sector. I've already said that foundation trusts, for example, are able to secure resources in a different way to NHS trusts. So the decision is to pause, to coin a phrase, and to wait until we've secured the decision for Epsom Hospital before any further work is completed. Then going on to service change, which again I'm sure is something that many of you are concerned about. Just to be clear, the transaction process to complete the job in hand, which is to secure foundation trust status for our hospitals by the deadline, is not about service change. The expectations set out in the information that will be sent to the preferred bidders in June will be making it very clear that their bids will be and will need to describe services as they are, or improved and developed, not reduced. So one of the key criteria will be to judge the applications that those organisations make on the basis of how they will secure and maintain acute services on this site and develop them further and develop the site further. So the transaction process is not about shutting services, reducing services. It is about securing the foundation trust status within the timeline that's been set at the 1st of April 2014. Now you see up on the slide there I've referenced the influence of GPs. Let's just be clear, whether the health bill goes through Parliament or not, we've embarked on a journey which I think is good for patients, and that journey is bringing our GPs and our hospital doctors and clinical teams much closer together through the approach of development of GP consortia and clinical commissioning to be much more in tandem and working together to decide what is right for patients, where patients' care should be delivered, and what sort of services should be provided within a hospital setting. So whether or not the white paper turns into the health bill as is being currently considered, I believe that GPs will have a greater influence in the way in which services are provided, the way in which services are commissioned, and therefore if anybody thinks that the world isn't going to change in 5 or 10 years' time on the basis of GPs not having an influence, I'm afraid I think that is not going to be the future that we're going to see. So I think it's important that everybody recognises that irrespective of the position of the health bill, I think the importance of GPs and hospital doctors working much more closely together to focus on what's right for our patients is a good thing. But I will reiterate the final point there, that any service change is not considered as part of the transaction process. It is not about shutting services, it's not about reducing services on either of the sites. It's about securing acute services and developing them further in the future.